Hi there! Welcome to this video on the first week with a newborn baby. We will learn more about the following: the importance of establishing breastfeeding as soon as possible by understanding the newborn baby's hunger cues, responding to a baby appropriately by understanding what he or she needs, the indicators of adequate feeding, safe sleeping suggestions. What is the best sleep arrangements for you and your baby? And finally, how to care for the mother in the first week after birth. We need to understand the baby's hunger cues amongst his other needs. Some common hunger cues include sucking on fists, fussing, turning toward the breast, and crying, which is a late sign of hunger. When it's time for baby to feed, the mother should hold her baby close to her breast in any of the breastfeeding positions comfortable for her. Some tips to ensure the mother's comfort include ensuring the back is straight and supported. If sitting up, the mother's lap and feet should be supported. Pillows or cushion can be used to support her back and/or arm. Baby should be held close and facing the mother's breast with his head, shoulder and body in a straight line. Bring the baby to the breast instead of moving the breast towards the baby. Aim the nipple towards the baby's nose or top lip. Baby should be able to reach breast easily without having to stretch or twist. The mother can then guide baby to latch onto her breast by bringing the baby's mouth over and above the breast. Once baby has latched well, the mother should ensure she is comfortable too, to avoid backache and tired arms. If the latch is painful, detach and reattach baby. If the problem persists, seek professional help as early as possible. If direct latching is not possible, alternative modes of feeding include the use of a syringe, cup or spoon. As far as possible, avoid using the bottle until breastfeeding is established to avoid nipple confusion. Some women may find it more difficult to breastfeed. Consult a lactation-trained expert if necessary. While breastfeeding is recommended for benefits to both mother and baby, it is important to do what is best and most comfortable for both. If mother's breast milk is insufficient, other sources of milk are used when necessary. The baby's feeding intervals may vary throughout the day between 1 to 3 hours. It is important to understand the baby's body language to decode what he or she needs. To figure out the baby's cues, we check for the following. 1. Diaper check. Is he wet or soiled? If so, then it's time for a diaper change. 2. Comfort check. Does he need a burp or a gentle swing or soothing sounds? Try out different positions to hold and comfort baby. Hold the baby's neck, shoulder and buttocks and bring baby close to your chest. Or bring baby over the shoulder with one hand while holding baby's head with the other hand. Baby's belly button should be just slightly below your shoulder for the over-the-shoulder position. Rock and swing the baby gently, as the swinging motion might calm the baby. Swaddle or wrap the baby up to keep baby safe and secure. Swaddling mimics the intrauterine environment and helps baby to sleep longer, thereby giving mother more rest. Hum a soothing tune to the baby. A shh sound helps. 3. Finally, check if he's really hungry. Learning how to decode a baby's cries take time to observe and listen. The sooner the parent can decode this, the faster the adjustment process can take as the parent understands the child better. Look out for the following indicators of sufficiency and satiety in the baby. 1. Baby is comfortable and suckles for a period of time with strong sucks that get lighter. 2. Baby detaches himself from the breast and looks sleepy and calm. 3. At the end of each day, the baby has passed sufficient stools and urine. Apart from the number of pees and poos, we also look at the color. On the first day, the stool may appear rather dark or black and sticky. We expect the stool color to change from dark black to brown black, greenish black, and gradually becoming chrome yellow. The texture will also vary from runny to pasty or even seedy. The amount of stools will vary from individuals. The frequency and color of urine also changes over the first few days, with possible pink stains till day 2 or 3. The pink stains are urate crystals and indicates concentrated urine. We can also use the condition of mother's breasts as a gauge. After feed, mother's breasts will be softened and feel significantly lighter. She should also hand express to check flow and ensure that there are no lumps in her breasts. Some mothers may experience a hardness to the breasts known as engorgement during the first few days. It is helpful to keep breastfeeding, massaging, and expressing the milk out to prevent build-up and blockage of milk ducts. In between feeds and expression, applying cold compress helps the mother to feel more comfortable. Sleeping arrangements are important at the beginning. Rooming in, where baby sleeps in the same room, in a crib next to the mother's bed, is the recommended way which allows new parents to get to know and care for your baby. A safe crib is important. Ensure that the baby's crib is free of items that might endanger him. Sometimes mothers lie down during breastfeeding. A safe and recommended breastfeeding position is the cuddle position. It is advisable for mothers to rest in between caring for her baby. When her baby sleeps, mothers should take the opportunity to take a rest also. In that way, she is pacing herself to cope with the change in the demands of her time and energies. The first week after giving birth is definitely a challenging one, as both mother and baby recovers from the delivery process. One way to prepare yourself is to arrange for additional help during this period. For new mothers, learning to breastfeed can be challenging or overwhelming. Try out different breastfeeding positions and readjust or reattach your baby to find a comfortable and painless breastfeeding position that suits both mother and baby. Feeding the baby on demand every 1 to 3 hours also means new parents face a lack of sleep for the first weeks. It is important that new mothers find time to sleep by resting while baby sleeps in between feeds. Suggested solution: build a support system where members of the family or friends have roles they are comfortable with and happy to do, such as helping with housework, changing diapers, putting the baby to sleep, bathing the baby, feeding the mother well to ensure that she is well nourished and well hydrated. This will make the mother's role of breastfeeding the baby frequently in the first week seem more manageable if she does not feel that she has so much to do. It is common that the newborn baby and his or her needs take up all the attention of new parents, but it is important to establish care routines for both mother and baby. Caring for a newborn can be overwhelming. New mothers can experience issues with adjustment, causing doubt and feelings of vulnerability, which can lead to postpartum depression. Support from family and friends is essential. New mothers are encouraged to seek professional help early if necessary. If a mother experiences some of the symptoms here which have persisted or worsened, she is strongly encouraged to seek advice from a doctor or healthcare professional. The Women's Emotional Health Service offered at National University Hospital is able to assist mothers. The earlier she seeks treatment, the better the outcome. Speak to your gynae or doctor if you have any concerns. Thank you for watching this video. Having a newborn in the family is a momentous occasion with wonderful joys and also challenges. And we are here to help you in your pregnancy and post-delivery journey.